Good day. Myself, Pushpalata Marimutu, going to present my case study that is about myocardial infarction. This case details, it's about a patient, 75 years old male, was involved in this case. This patient was a Chinese. He was a retiree. The patient history was chest pain or discomfort, pressure, squeezing or pain, discomfort in the upper body, arms, back, shoulder, neck or upper part of stomach, shortness of breath. The blood types of blood collected was blood sample, usually needed in order to perform cardiac enzyme. Okay, this is about cardiac enzyme, high sensitivity cardiac troponin T. Okay, this test are primarily ordered to diagnose a heart attack. The proteins are released when the heart muscle has been damaged. It usually take 2 or more times over the next 6 to 24 hours. Collected by venipuncture, analyzed by Roche-Cobas 6000 analyzer. Then another test is creatine kinase MB, CKMB test. It's a follow-up test for primary source of CKMB is myocardium, and the levels is increased with myocardial damage. The next test is lactate dehydrogenase, LDH. It's an enzyme present in many different cells. It's to analyze the different LDH isoenzymes levels in the blood that can help in diagnosis of some disease. The C-reactive protein, it's a marker of inflammation, meaning its presence indicates of increased state of inflammation in the body. The complete blood count of myocardial infarction, suspected in order to rule out anemia as causes decreased oxygen supply. The white blood cells, the indication of infection or inflammation. Okay, this is the result of the test. The high sensitivity, the troponin T is high, CKMB is high, and the lactate dehydrogenase is also high. The white blood cell is high, and the C-reactive protein also high, more than the reference range. Okay, troponin T is a protein found in the muscle cell of the heart. Normally, troponin T level will elevate in myocardial infarction condition. So, the troponin T released from myocytes when myocardial damage occurs. It's highly specific to cardiac tissue. The CKMB is found mainly in the heart, and the level of CKMB will elevate individual with heart attack. The injured heart muscle cells release CKMB into blood. It shows that heart have been damaged. LDH is most often measured to check tissue damage because heart is an organ relatively rich in LDH. WBC high levels signal the presence of inflammation in blood vessels. The final diagnosis of my case study is the patient was myocardial infarction. Based on the laboratory report, it showed that the patient has a high value in cardiac enzyme, which is most important to test the excess myocardial infarction. Thank you.